If you've ever experienced low back pain when lifting overhead or doing overhead press, then listen up. My name is John, and I'm a doctor of physical therapy. My entire goal here is to provide you with information that will help you to live a long and active life. I've seen too many people who are deconditioned, have chronic pain, and they honestly have a pretty poor quality of life. My goal is that we can help you avoid that, and hopefully that's what you want too. Now, regarding overhead press and low back pain with that lift, there are several different things which could be the cause. This isn't an exhaustive list, but these are what I believe to be the 5 most likely causes of low back pain. So the first reason why people's backs tend to hurt is because they are trying to lift a weight that is too heavy for their body to handle. Of course, we should try and lift heavy weights. The issue comes with lifting heavy weights with poor form. Without immaculate form, we place ourselves at risk of injury. With an overhead press, the compensation we tend to see when someone tries to lift too much is they will lean backwards and then push the weight out in front of them. The reason being that we are actually much stronger pushing forwards than we are pushing overhead. So take bench press or even an incline bench press. Everybody I know is stronger in those two lifts than they are with an overhead press. Because the body is naturally stronger in this position, when doing an overhead press, if the weight's too much, our body naturally leans back to place the shoulders in a stronger position, similar to that of an incline bench press. The issue here comes with the extra curvature of the low back. The low back is designed to carry weight, but it does this when it's in a neutral position. When we curve back and then place extra load on the back, it is not as capable of bearing this load as it would be if it were more neutral. This next reason is very similar to the first in the compensation we will see, but instead of lifting a weight that's too heavy, our shoulders are too tight to allow for a strict overhead press. Now, if you have a tight shoulder when lifting overhead, again, the body will compensate by leaning backwards in order to allow for a more vertical position of the shoulder. If we do not do this and we are lifting out in front of us, this lift becomes exponentially harder. If this is as high as I can lift my shoulder due to inflexibility, you can see that I will want to lean back until the point which my arm is near vertical. The only way to achieve this is by extending the low back. So we get the same result as with lifting too heavy. We curve the low back, and this places us at risk of injury. If you have tight shoulders, before doing this lift, I would recommend stretching them out. Now, we just talked about tight shoulders in the motion of flexion, but a tight lat will also adversely affect this lift in a negative way. Similar to what we saw before, we will lean back to compensate for the tight muscle. At the same time, because the lat has an attachment site on the pelvis itself, this will further accentuate that curvature, meaning that we have additional risk of injury. To effectively stretch your lat, what I like to do is grab a band that is anchored to the wall, bring my hips back towards my heels, and then rotate my body so the side I'm trying to stretch is on top. You should feel this extending all the way down your side. This next issue has to do with the resting posture of your pelvis and low back, specifically that of an anterior pelvic tilt. You may or may not have heard of this, and some people actually argue if it matters at all. I think it does, specifically for weightlifters. For the same reason that we discussed before, if the low back is not in a near neutral position, it is not as capable of supporting load. So when we have an anterior pelvic tilt and the low back has extra curvature to it, we are placing ourselves at risk of injury. What causes an anterior pelvic tilt is tightness of the hip flexors, likely from sitting too much, as well as tightness of your lumbar paraspinals, and then weakness of your abdominals, your glutes, and your hamstrings. As a side note, because of the way this rotates the pelvis, people with an anterior pelvic tilt tend to have tighter hamstrings. So if we can correct this posture, you might notice more flexibility in your hamstrings as well. To correct this, we need to target the abdominals, the glutes, and the hamstrings for strengthening, as well as stretch out your hip flexors and then your low back muscles. Following up on what we just said, because pelvic posture is important for aligning the low back, if we actively engage our abdominals and glutes during the lift, we can help prevent that anterior pelvic tilt posture and keep the spine in a more neutral position. Additionally, because we are engaging our abdominal muscles and the other muscles of our core, this will help support the lumbar spine, allowing it to better handle weights. As a side note, and this is probably somewhat of a hot topic, but there are definitely some people who need to hear this. Having a bulging disc in your back doesn't necessarily matter. Unless you are actively having numbness, weakness, or pain going down either leg, the disc likely isn't causing you any issues. Just because you have a bulging disc and you have back pain does not mean the disc is causing your pain. You could take an MRI of anybody on the street. Most people would likely have a bulging disc, but that doesn't mean that they all have pain. So, if you do have a bulging disc in your back, you can definitely still lift heavy weights. And I would argue that this is even beneficial because of the way it'll engage your core muscles to help support the spine long term. If you've been struggling with this, hopefully you found this video helpful. Something to keep in mind is that there is no rule that says you can only have one of these issues at the same time. You very well may have many things going on. And then once we identify and correct all of them, you will have a pain-free lift.